So thanks everyone for coming along. I'm Dr. Laura Goodwin, so I recently joined Lancaster University and I'm an academic working in mental health research. So I'm the new mental health theme lead and I'm a senior lecturer at the Spectrum Centre for Mental Health Research. So at Lancaster we have a really large number of academics working in mental health research. And our work takes a life course approach and spans from understanding which groups are more likely to develop mental health problems, what experiences might be linked with the development of mental health problems. And we're also doing a range of stakeholders to understand how we can help develop the best interventions for people who are experiencing mental health problems. So obviously then mental health is a really broad area. So for that reason, we do a lot of work in collaboration with the other groups. So for example, public health, health inequalities, or health and economics, and also with the end of life care group. So this means that if you do a PhD in mental health research, it may sort of bridge a number of areas. So you may work with one supervisor from the mental health group, but also with another supervisor who has the expertise from one of the other research groups. So at Lancaster then we've been awarded a range of really competitive funding from a range of sources such as the National Institute for Health Research, and this has primarily been to fund interventions really renowned for, also funding from the Medical Research Council, from the Economic and Social Research Council, and we've also got funding from the third sector, so from different charities that we're working with. One of the key groups conducting mental health research in DHR is the Spectrum Centre for Mental Health Research. Research in DHR is the Spectrum Centre for Mental Health Research. So this group is led by Professors Loban and Jones. We have specific expertise in developing research around bipolar disorder and also other serious mental health conditions. And specifically, the group has a really strong track record of funding for developing and testing psychological intervention. So the team is really unique and is renowned both nationally and internationally for the work that we do in having a really key involvement of people who have lived experience of mental health problems and who work as part of our research. We have a permanent member of staff who is a service user researcher. So they've worked with the group to support the development of interventions that both meet the needs of the service users, but also that are suitable for those who are delivering them. So we're developing interventions that we know will work in practice and that people find them really helpful. So this involvement from people with lived experience of mental health problems means that the research we conduct has wide-reaching impacts. So this is one example of a toolkit that has been developed for families of people with psychosis or bipolar disorder, and it's now being used within NHS trusts, so within hospitals and mental health services, to support families to increase their capacity to support their relatives. So the work that we're doing isn't only about working with people who have mental health problems themselves, but also looking at how we can support families. Another example of research impact from the mental health group has been looking at the links between mental health and physical health, and we have expertise in studies around this area. So for example, we know that people with a mental have a lower life expectancy and they're more likely to develop physical health problems earlier in life. And one of the things that they've been shown to have poorer outcomes is around their oral health. So members of our team were involved in developing this list of recommendations to improve oral health, and that was kind of a first step. And then this has led to funding from the NIHR for the development of an intervention study to work with people with mental health problems to look how we can improve their oral health. So in terms of the key features of the mental health research at Lancaster, then as I said, we're engaging with people with experience of mental health problems, and we're doing that across a number of ways. So we're working with them to look at actually what research areas are most important to them and what should we be focusing on. Also looking at how we implement the research, so getting their feedback, for example, to participants, or if we're putting together a questionnaire or an interview, getting their input on how the questions sound, does it all make sense? And also a key role has been their involvement in the design of interventions and making sure that they're suitable for the people that we're aiming to target. And then we're working with people with lived experience also to think about different ways of disseminating the findings and making sure that the findings are going beyond just an academic setting. So I'd say that we have a really strong emphasis on the social and psychological influences on mental health rather than on a biomedical model. And we're also doing work to recognise both the positive and the negative aspects of living with different mental health experiences. So some of the examples of research areas are around understanding the psychological, the social and the environmental factors, but also resilience in mental health. So what are the factors that can help people recover from mental health problems or to manage their symptoms and, for example, to be able to achieve everything that they would want to? And there's a lot of work that's been undertaken within Spectrum that's focused on the development of novel interventions. So they're really sort of interesting areas of research that you could get involved with as potential students. And they're not just looking at developing interventions for people with mental health problems, they're also looking at interventions for their carers and family members, interventions that are focused around people who've developed both physical and mental health problems. And an area that I'm doing a lot of work in is looking at intervention development for people who have co-occurring mental health and also alcohol problems, given that we know that alcohol problems really commonly occur with mental health. The kinds of projects that you could engage with if you came to study at Lancaster, then I mentioned the leads for the Spectrum group, who are Fiona and Steve. So Fiona, the areas that she's working in are around peer support for mental health, also around online forums and development of digital interventions, and work around supporting family and friends. And the kinds of approaches that she is applying are using mixed methods approaches, but particularly focusing on sort of realist synthesis and realist reviews. So Stephen Jones is doing a lot of work and has led trials around personal recovery in severe mental health problems, and is currently running a big trial to support parents of children who have severe mental health problems. And Steve's also really interested in the mechanisms of how these interventions work. So what is it about these interventions that mean that they're... So this is me. So my research areas are around, as I said, the co-occurrence of mental health and alcohol problems specifically, but I'm also interested in the association of mental health and other health behaviours, such as diet, physical activity. And then in terms of what we can do, I'm doing work around development of behaviour change interventions that might be targeting, for example, alcohol use or people's physical activity, and how we can make sure that these are appropriately tailored for people with mental health problems. And then one unique area that I'm doing research around is around military and veteran mental health. So, for example, looking at the co-occurrence of post-traumatic stress disorder and alcohol use. And then finally, another person that you would be working with in the mental health group is Dr. Guillermo Parasol-Gorta, and in some similar areas to me around risk-taking behaviours and mental health, but specifically has a unique research portfolio around sleep mental health, and also work around child and adolescent mental health. So you can see that we've got a really broad areas of interest, and there's real potential for working with us to develop interventions and unique research projects around mental health. Okay, thank you.